Avoid giving a child under 4 cough or cold medicine. Cough and cold medications can have serious side effects for babies and toddlers. Only use cough medicine if your child is over the age of 4 and their pediatrician recommends it. For some serious conditions, a doctor may prescribe medication. Only give your toddler medication that is prescribed by their pediatrician. Give your toddler 2 teaspoons, 10 milliliters, of honey at bedtime. Honey is safer than over-the-counter cough medication and can have the same effect. Give your toddler 1 small spoonful of honey to loosen the cough. Babies under 1-year-old should not have honey, since there is a risk they could contract botulism. It is safe for toddlers over the age of 1. Some sources recommend waiting until a toddler is older than 2 years before administering honey. Rub a menthol ointment onto your toddler's chest. To make your child feel less congested and sleep easier, rub some menthol ointment onto their chest. The scent of menthol helps you feel less congested and like your airways are opening up. Some swear by rubbing menthol ointment on the feet and then covering them with thick socks. While there isn't a scientific explanation for this, lots of parents still use this trick. Use saline drops to loosen nasal mucus. Nasal mucus can cause post-nasal discharge that leads to coughing, but using saline drops may help. Saline is a saltwater solution that you squirt into the nose to clear up mucus. Squirt 3 drops in each nostril and have your toddler blow out to rinse. Repeat until the solution comes out clear. You can buy saline solution at drugstores, or make your own by combining 1/2 teaspoon, 2 grams, of salt with 1 cup, 240 milliliters, of water that has been boiled and cooled. Clean your toddler's environment to soothe the cough from irritants. Environmental irritants can cause a toddler's cough or make it worse in some cases. These irritants may include things like dust, pet dander, cleaning products, and smoke. Some strategies that may help include keeping your child's environment clean, such as by dusting, vacuuming, and tidying up often. Preventing pets from entering your child's bedroom if pet dander may be to blame for their cough. Running an air purifier to filter dust, pet dander, and other irritants from the air. Help your toddler stay hydrated with water, milk, or juice. Drinking liquids can help thin out mucus that gets caught in the throat and causes coughing. Water is ideal for staying hydrated, but milk or juice both help with coughs too. Avoid orange juice, since it can irritate a sore throat. Feed your toddler chicken soup. Chicken soup is comfort food and also works wonders for coughs and colds by reducing inflammation in the throat. Homemade and canned chicken soup both soothe coughs and help sick kids feel better. 9 Chicken soup can also hydrate a sick toddler, but make sure your child drinks lots of other fluids as well. Elevate your toddler's head with a few pillows. To help your child sleep comfortably, place some pillows under the head, back, and shoulders to prop up the head. This will help your toddler breathe easier and get some sleep. Elevating the head helps reduce postnasal drip that can cause coughing. Run a hot shower to let your child breathe humid air for about 10 minutes. Water vapor in the air can help ease coughing. Run a hot shower in a bathroom for a few minutes, and then let your child sit in the room as it fills with steam. Read or play in the room so that your child relaxes. Use a cool water humidifier in your toddler's room at night. Moist air helps keep the air in the nose and throat from drying out. Running a humidifier at night can help your toddler sleep comfortably and cough less. If you don't have a humidifier available, hang a damp towel in your toddler's room. Call the doctor if your toddler has a barking cough or wheezing breath. If your child has a cough that sounds like a bark followed by a high-pitched squeak, it may be caused by croup. Wheezing breath and a phlegmy cough could be caused by bronchitis. A pediatrician can advise on the best treatment for croup or bronchitis. Take note if the cough doesn't go away or starts to get worse. Keep track of when your toddler started coughing. If the cough doesn't go away within 10 days, call a pediatrician. If the cough starts to get worse, call a pediatrician right away. Most of the time, a cough is caused by a common cold, but if you are worried, it doesn't hurt to call a doctor. Call your pediatrician if your toddler develops a fever or seems lethargic. Signs of a more serious infection include a high fever of more than 100 degrees Fahrenheit, 38 degrees Celsius, or unusually low energy. If a fever lasts for more than 2 days, see your pediatrician as soon as you can. Low energy can be a sign of a cold. Talk to your doctor if you think it could be a sign of something more serious. Go to your doctor right away if your toddler has trouble breathing or vomits. A coughing fit that is so violent it causes your toddler to vomit is cause for concern. You should also see a doctor if your child has a difficulty breathing during a coughing fit. Your child may turn red during a coughing fit if they have trouble breathing.